Good afternoon, everyone. We're here with Dr. Akash Kapadia. He's a urologic surgeon at Georgia Urology, and you're a Center of Excellence surgeon in the AMS 700 penile implant. So could you tell us a little bit about what that means?
Yeah, so once again, my name is Dr. Akash Kapadia. I'm a men's health urologist. That means I'm fellowship trained in male infertility and men's sexual health. So CJ, you mentioned Center of Excellence. Center of Excellence is awarded to a very few number of penile prosthetic surgeons, who many of them have completed a fellowship in male sexual medicine, but also do a high volume of these surgeries, have incredible outcomes for their patients, are dedicated to patient education, and do outcomes-based research. So it's a very coveted designation awarded to perhaps a few folks around the country.
Tell us a little bit about the causes of erectile dysfunction.
Yeah, so first I'll just say erectile dysfunction is the inability to get or maintain an erection that's satisfying for intercourse. Primarily, the most important cause of erectile dysfunction is vascular dysfunction. The penis is, as I say, a hydraulic system, which has an inflow and an outflow, just like our vasculature. And so damage or dysfunction of the vascular system is probably the most common cause of erectile dysfunction.
And so when a patient does come in, what is your discussion about treatment options? Where do you start and what's the progression?
Yeah. The very first thing I'm doing is assessing the general health of the man. We know that ED can be a precursor to multiple other medical conditions that patients can be suffering with, including cardiovascular disease. So the first real test is the eyeball test. I sort of evaluate the patient's general health to see what else could be going on affecting this man. Beyond that, when it comes to treatment, I'm trying to understand what's causing the ED and sort of target their treatments based on that. As many of my patients know, and what's out there, what folks need to realize is that there are 5 FDA-approved treatments for ED or erectile dysfunction. Often we start with oral medications, and beyond what we call beyond the pills, there are 4 other treatments that include a vacuum device, a suppository in the urethra, injection in the penis, all the way leading up to a penile implant. But these are the 5 FDA-approved treatments that we have for erectile dysfunction.
And you know, in researching this and understanding the penile implant, it was really interesting to know how discreet it is. Can you sort of speak to the benefits of that? Because I think many people wouldn't realize that a surgery is that discreet.
Yeah, that's exactly right. And when I broach that topic in clinic, you just get those big eyes like, what the heck are you talking about, right? So I just take a pause and say, listen, you're going to go home and really understand how this works before you make any decisions. It is very discreet. It's done through an opening in the skin, super tiny. It's either above the penis or even below the penis on the scrotal side. So it really is hideable. I have plenty of patients that their partners had no idea. We did their repeat surgeries when the partner discovered that they have an implant. That has happened on many occasions. That's how discreet it is. The healing process is super quick. And really there's no external evidence that you've got something foreign in the body. You know, the pump is not visible unless you really, really sort of put a microscope on it, on the scrotum. The cylinders are certainly not visible through the penis because they lie in the natural space of the penis. And the reservoir is well away from any visible area. So really it's extremely discreet. Patients go through, they go to the locker room for showers and nobody ever knows. They go through the airport and nobody ever knows. So it is extremely discreet. And as I mentioned, a lot of times partners are more likely to realize you have something foreign when you're either taking a pill or giving yourself a shot. Whereas an implant, you can cause an erection within seconds, and your partner would never know. So it is very discreet.
Fantastic. Well, thank you, Dr. Kapadia. Appreciate the insight into that and appreciate your time.
Awesome. Thanks.